The history of mental health has spanned a long time, yet advancements in the fields of research and treatment have mostly happened in the last few decades. This has likely occurred due to slightly reduced stigma and increased awareness. Mental illness used to be so heavily stigmatized that most people experiencing it were forced to stay quiet about it, were taken away to low-quality asylums, or tried to have it removed through methods ranging from exorcisms to shock therapy to lobotomies. There have been huge developments in the field of mental health, finding out more about the psychological and biological factors involved, as well as the epidemiology of various mental disorders. Epidemiology is the study of the incidence, distribution, and control of disease in a population. This will be important later on. There's much more awareness about mental illness today than there used to be. Many celebrities and influential individuals have opened up about their experiences with mental illness and discussed it on many forums. Actors like Catherine Zeta-Jones and Jim Carrey have talked about their experiences with mood disorders like bipolar disorder and depression. Some famous individuals are also fairly open about their experiences. For example, J.K. Rowling, author of the world-famous Harry Potter novels, has been open about how writing the first Harry Potter book helped her deal with depression. Some characters were even inspired by her experiences with it, namely the shadowy creatures that feed on happiness, known as Dementors. Buzz Aldrin, who set foot on the moon in 1969, developed depression and an alcohol addiction. After recovering, he became the chairman of the National Association of Mental Health. Many skilled and influential people like Marlon Brando, Ernest Hemingway, Princess Diana, and President Abraham Lincoln displayed signs of depression. Mental illness has taken away many individuals who were talented and loved, like Heath Ledger and, much more recently, Robin Williams. So many brave people have come out about their experiences, yet the stigma against it is still significant. Those who aren't aware of their severity often write off people with mental illnesses as being crazy or having personality faults. People with depression are often seen as being sad and or lazy, when there are various psychological, social, and even biological factors contributing to the uncontrollable mental stress, interfering with one's ability to enjoy and properly conduct everyday activities. With anxiety disorders, subjects are seen as being excessively shy or introverted, whereas in reality they can be suffering from one or many uncontrollable, extreme, irrational fears. Mental illness is not just a phase or something that can just go away overnight. It can be the result of various biological and genetic factors. Changes in chemistry of the body and brain can also influence behavior. Trauma and abuse during childhood and adulthood can result in various mental health problems due to influences on learning, negative associations, reward systems, and various other factors. Family history of illnesses can also have a significant effect, which we will explore later. Another misconception about mental illness is just how common it is. At least 1/5 of American adults experience mental health issues, and that's not necessarily counting adolescents experiencing various symptoms, as 50% of people with a mental illness experience symptoms before turning 14. 75% of people with a mental illness experience these same symptoms before turning 24. To get a bit more specific, we'll be focusing on depression, anxiety, eating disorders, and schizophrenia, as these four disorders tend to affect people in the age group of college ages and high school ages. 16.2% of US people meet the criteria for depression, and women are 2 times more likely to experience it than men. Poorer individuals are 3 times more likely to experience depression as well. Depression has a high comorbidity with anxiety of about 60%. Comorbidity is the simultaneous presence of 2 chronic conditions in a patient. 18% of adults in the US have some form of anxiety disorder in the form of phobias, social anxiety disorder, panic disorder, and general anxiety disorder. Women are much more likely to experience anxiety disorders than men. This may have to do with reporting bias. That is to say, women may be more likely to report anxiety as the gender norm for men is to be strong and courageous. Having an anxiety disorder may lead to men being perceived as weak. Another way gender roles are involved is that social pressure may cause more women to have anxiety-related disorders. Anxiety is also seen in 8% of American adolescents, yet only about 18% of those diagnosed end up receiving care. The prevalence of eating disorders is currently not known, but is being researched. It is much more common in females than it is in males. Eating disorders are also often seen with anxiety disorders, and the two have a very high comorbidity. Schizophrenia is thought to affect about 70 million people globally, or about 1% of the entire world's population. Mental illness is much more prevalent than most people would believe, and increased awareness of its global presence could greatly improve the opportunities and treatment received for those experiencing mental illness. As discussed before, genetic factors and family histories can be heavily involved in passing on a mental disorder from generation to generation. Heritability is the proportion of observed variation in a particular trait, like height, that can be attributed to genetic factors that are inherited, as opposed to environmental factors. The chances of acquiring a mental disorder tend to be higher with a parent or relative with the same disorder. For example, bipolar disorder has a 93% heritability, meaning that the chance of a child developing bipolar disorder is 93% when a parent has bipolar disorder. If a close family member has an anxiety disorder, that person is more likely to develop some form of anxiety disorder. In regards to eating disorders, if one has a first-degree relative with anorexia, one is 10 times more likely to develop anorexia. If a first-degree relative has bulimia nervosa, one is 4 times more likely to develop bulimia. Schizophrenia has an 80% heritability, and as can be seen by this chart, the more closely related one is, genetically, to a subject with schizophrenia, the more likely it is for them to have schizophrenia or to develop it. Now that we've discussed how common mental health disorders are, it's important to know what to do when concerned with the mental health of a relative, friend, or partner. Oftentimes, people who are going through mental illnesses who don't know much about them think they're going crazy or are insane. It's important to let them know that it's as natural as any other body disorder, and to recognize that it can be frightening and stressful due to the behavioral symptoms that arise. There are various myths surrounding the abilities of others to help those suffering from mental illnesses. One such myth is that recovery from mental illness is impossible, but many have totally recovered through seeking treatment. Some patients, while not totally recovered, have improved many aspects of their lives through therapy to the point that they are comfortable dealing with their mental illness on a day-to-day basis. Myth number 2. Pills are a sufficient solution and therapy isn't necessary or helpful. Why go through all that if you can just take medication? It's true that there are many prescriptions available for those suffering from mental illness, and oftentimes treatment will include medication. But it's important to recognize that pills can't cure all things. Medication affects body chemistry and can even have harmful side effects. Cognitive behavioral therapy helps patients recognize their current way of thinking and help them to find a way to change the associations that have led to the behavioral factors of the mental illness that they're suffering from. Myth number 3, there is no way to prevent it. Reducing stigma and having a better social and emotional environment during childhood can have a very strong effect on preventing mental illness. Myth number 4, I can't help someone with a mental illness. Many have done it, and supportive friends and family are often crucial for recovery. Here's how you can help. Learn more about mental illness to recognize signs of health problems. Express concern and ensure your support. Openly listen to them non-judgmentally. Offer to help out in any way possible. Be respectful. And remind your friend that help is available and they're not alone. For parents and other close ones, keep an eye out for specific behaviors like social withdrawal, suicidal ideation, sudden unexplained fearful behavior, major changes in eating behavior, severe mood swings, and behavioral or personality changes. Take particular care around transition events during a person's lifetime. For example, many students start feeling anxiety upon entering high school or college, and depression also becomes apparent at these times. Eating disorders are often seen in females during adolescence, when exposed to media images, and if there's any teasing or expectation regarding their appearance. If someone close to you is looking for treatment and needs some support going to a therapist, you can even offer to go with them. It's important to remember that you are not fully responsible for the well-being of a friend, and while there's a lot you can do for them, they are ultimately responsible for their own treatment. Talk to them and let them know that they're in a safe environment and that talking to a neutral, uninvolved third party can be extremely helpful. Myth number 5. It is impossible to reason with someone with a mental illness. People with mental illnesses have a slightly different mindset than those without, but that doesn't mean that they're unreasonable. Open and healthy communication is a crucial factor in the recovery of a friend or relative. Here's how to talk to a person with mental illness. Just ask straightforward questions in a safe environment. Make sure they're comfortable talking. Make sure you both are trying to clearly understand each other. Recognize that mental illness is a highly subjective experience and that one can't fully understand the mental states involved. Taking care of and getting help for a friend or relative with mental illness can be easier with more awareness about mental disorders, the kind of care that can be received, and how one can help with treatment. If we work together to reduce the stigma against mental illness, we can come to a greater understanding of how the mind works and what we can do to foster a healthy and fulfilling lifestyle for people who feel isolated and maybe just a little misunderstood.